Welcome to our deep dive today into a topic that's both challenging and incredibly important for nurses' acquired and congenital conditions impacting newborns.
Absolutely.
We've got a stack of medical texts and research articles.
Yeah.
And we're going to break them down into those need-to-know pieces of information that you need at the bedside.
Absolutely.
Whether you're a nursing student or faculty.
It's about making sure you have the knowledge to provide the best care possible in these sometimes really delicate situations.
Okay, so first things first, let's define our terms.
Okay.
What do we mean when we say acquired versus congenital conditions?
So acquired conditions are those that develop after birth.
Okay.
And they can be caused by a whole variety of factors like pregnancy complications or delivery complications.
So not something the baby is born with. It's something that happens.
It happens along the way.
After birth.
Yep. Okay.
And then we have congenital conditions, which are present at birth. And those are often caused by genetic factors or chromosomal abnormalities.
So things like heart defects or Down syndrome would fall under that congenital category.
And unfortunately, these conditions are still some of the leading causes of infant morbidity and mortality.
Wow.
Even with all of the advancements that we have in healthcare.
Yeah.
And that's why your role as a nurse is so vital.
It really highlights the importance of early recognition and then careful management.
Absolutely.
Providing support to both the baby and the family.
Absolutely.
Okay, let's dive into some of the specific acquired disorders that we're talking about.
Okay.
One that can be really challenging is HIE.
Hypoxic ischemic encephalopathy?
Yes.
Or HIE?
I remember learning about HIE in class.
Right.
And it was a lot to take in.
Sure.
What are some of the key takeaways for nurses about HIE?
So with HIE, it's a race against time to get oxygen to the baby's brain.
Oh. Yeah.
So if we have a baby that is showing signs of HIE,
then immediate resuscitation is critical.
And I remember reading about a treatment for HIE called Therapeutic Hypothermia.
Right.
It almost sounds counterintuitive. You're literally chilling the baby to protect their brain.
They cool the baby's body down to slow down brain metabolism and try to reduce any further damage.
It must be such a difficult decision for parents to make, weighing the potential benefits against the risks.
Absolutely. And informed consent is so crucial here.
Yeah.
Parents need clear and compassionate explanations to really understand what's happening and make the best choice for their baby.
Okay, let's move on to some other respiratory challenges that newborns can face.
Right.
Our sources mentioned TTN, RDS, and MAS.
Okay.
What's a quick rundown on these?
So these are all conditions that affect the baby's breathing, but they have different causes and they require different approaches to care.
Okay.
So the first one, transient tachypnea of the newborn, or TTN, is usually a short-lived condition. Okay.
It happens when fluid in the baby's lungs isn't cleared out properly after birth, which causes rapid breathing.
And this is more common in babies delivered by C-section, right?
Yes, because the squeezing action of a vaginal birth actually helps clear fluid from the lungs.
Oh.
So with C-sections, that natural process doesn't occur.
So even though C-sections are often considered a safer option, they come with their own set of complications.
Exactly.
Okay.
But TTN is usually managed with supportive care, like supplemental oxygen if needed.
Okay.
And most babies recover really quickly.
Now, what about RDS?
So respiratory distress syndrome, or RDS, is a little more severe.
Okay.
It primarily affects preterm infants whose lungs just haven't fully matured.
Okay.
They lack a very important substance called surfactant, which keeps those tiny little air sacs in the lungs from collapsing.
So these babies really struggle to breathe.
They do.
What can be done for them?
So surfactant replacement therapy is a lifesaver here.
Yeah. So we can actually administer doses of surfactant directly into the baby's lungs.
Wow.
And it's pretty incredible how effective that is.
Yeah.
We also may use some respiratory support like CPAP or even mechanical ventilation to help them get enough oxygen.
It sounds like those interventions can make a huge difference.
They can.
Now tell me about MAS. What makes that one unique?
So meconium aspiration syndrome, or MAS, happens when the baby inhales meconium, which is their first stool into their lungs during labor or delivery.
That sounds like a recipe for trouble.
It can be. It causes inflammation and breathing problems. And in severe cases, it can lead to persistent pulmonary hypertension.
So you're talking about a cascade of complications.
But, yeah. So management often involves respiratory support, oxygen therapy, and sometimes even mechanical ventilation, similar to RDS.
Okay.
And the goal is to clear that meconium from the lungs and support the baby's breathing until they can recover.
It seems like the key takeaway here is that nurses need to be super vigilant in recognizing any signs of respiratory distress in these newborns.
Absolutely. Being able to quickly assess and identify these different respiratory conditions is so important.
Yeah.
Early intervention is key to preventing further complications and ensuring the best possible outcomes for these babies.
Okay.
Yeah.
Let's move on and talk about some more of these conditions.
Sounds good.
Okay, so we've talked about HIE, TTN, RDS, and MAS, all conditions that can cause significant breathing problems for these little ones.
Right.
What's another condition that nurses should be aware of?
Okay, so let's talk about persistent pulmonary hypertension of the newborn, or PPHN for short. This is where the blood vessels in the baby's lungs don't relax properly after birth.
So instead of opening up like they should to allow for good blood flow, they kind of stay constricted, which means the baby struggles to get enough oxygen.
Exactly, and this can be really serious. PPHN often develops as a complication of other conditions like MAS.
So it's like this cascade where one thing leads to another.
Right.
Yeah, it really makes you realize how fragile these tiny systems are.
Absolutely.
And how quickly things can go downhill if we're not on top of it.
That's why close observation and quick intervention are so crucial.
Absolutely.
We need to be able to recognize those signs early on.
Like what?
Rapid breathing, bluish skin color.
Okay.
A heart murmur.
What are some of the interventions that nurses can expect to see in cases of PPHN?
So the first thing is we need to provide supplemental oxygen, support the baby's breathing. Sometimes medications are used to help relax those blood vessels in the lungs.
Okay, and in really severe cases, ECMO might be needed.
Right.
I know that's like a heart-lung bypass machine for these babies.
It is. It's a last resort.
Wow.
But it can be life-saving in those really critical situations.
Okay, switching gears a bit, let's talk about another condition that could have a big impact on newborns, and particularly those born prematurely.
Right.
PIVH.
PIVH is bleeding into the brain. And it's especially concerning in preterm infants because their blood vessels are so delicate.
Oh, wow.
Even just routine care can pose risk if we're not incredibly careful.
It's almost like you're handling a piece of delicate china.
That's a great analogy.
Yeah.
We need to be extremely cautious with handling, suctioning, even just repositioning these babies.
And the potential long-term consequences of PIVH are really concerning, right?
They are, unfortunately.
Yeah.
PIVH can lead to things like hydrocephalus, cerebral palsy, developmental delays.
Really, it makes you realize that every interaction we have with these infants can have a lasting impact on their lives.
That's why developmental care is so important in the NICU. It's all about creating this calm, supportive environment that minimizes stress and really promotes optimal brain development.
Now let's move on to a condition that affects the digestive system.
Okay.
NEC. This one always seemed a little bit mysterious to me.
It's definitely a challenging one.
Yeah.
NEC is a serious condition where a portion of the bowel becomes inflamed and can even die.
Wow.
It's most common in premature infants, but it can happen in full-term babies as well.
What are some of the risk factors?
So prematurity is a big one, as is formula feeding. Breast milk has protective properties that help prevent NEC.
So that's another reason why promoting breastfeeding is so important whenever possible.
Absolutely.
Yeah.
And when it comes to recognizing NEC, nurses play such a critical role.
What are some of the things they should be watching for?
So things like feeding intolerance, abdominal distension, bloody stools, changes in vital signs.
So being really observant.
Absolutely. Early detection is crucial because NEC can progress very rapidly.
Yeah, it sounds like a race against time.
It is.
Just like with HIE.
Yeah, so if NEC is suspected, we stop feedings immediately, start antibiotics, and closely monitor the baby's condition. Sometimes surgery is needed to remove the damaged portion of the bowel.
Okay, now let's talk about infants of diabetic mothers, or IDMs.
Okay.
These babies face unique challenges.
They do.
Because of their exposure to high blood sugar levels in the womb.
Exactly. They often have these characteristic physical features, like being larger than average, having chubby cheeks, sometimes even a no-neck appearance.
I remember seeing those babies in the nursery and thinking how cute they were.
Right.
But they definitely require specialized care.
They do. A big concern is hypoglycemia.
Okay.
Because after birth, their bodies are still producing a lot of insulin, which can cause their blood sugar to drop dangerously low.
So frequent blood glucose monitoring is essential.
It is.
Yeah.
And they're also at risk for other problems like respiratory distress, jaundice, birth injuries.
Because of their size.
Right, because of their larger size.
It sounds like managing an IDM involves a whole lot of vigilance.
It does.
And careful observation. Okay, now let's talk about something that, while rare, can be incredibly difficult for everyone involved.
Yes.
Birth injuries.
Birth injuries.
Sometimes, despite everyone's best efforts, the forces of labor and delivery can cause harm to the baby.
It's heartbreaking.
It is. It's hard to imagine what those parents must go through dealing with the unexpected trauma of their baby being injured during birth.
As nurses, we need to approach these situations with such sensitivity and compassion.
Absolutely.
Clear communication is so important.
Yes.
And we need to provide as much support and reassurance as we can.
Can you give us some examples of common birth injuries that nurses might encounter?
Sure. So fractures, brachial plexus injuries, which affect the nerves in the shoulder and arm.
Okay.
Cranial nerve trauma.
Okay.
And cephalohematoma, which is bleeding under the scalp. Those are some of the most frequent.
And of course, each of these injuries requires its own specific approach to care and management.
But beyond the medical aspects, it's so important to remember the emotional impact on the families. They need our empathy and our understanding as they navigate this really an unexpected and often traumatic experience.
Okay, now let's tackle a sensitive but increasingly common issue in the NICU.
Okay. Neonatal abstinence syndrome, or NARAS.
Yes, this is when babies are exposed to drugs in the womb and then go through withdrawal after birth.
Right. It's a heartbreaking situation.
It is.
And sadly, we're seeing more and more cases due to the opioid epidemic.
Yeah. What are some of the key signs of NAS that nurses should be aware of?
It can vary depending on the drug the baby was exposed to.
Okay.
But some common symptoms include tremors, irritability, high-pitched crying feeding difficulties, and even seizures.
I remember learning the withdrawal acronym to help remember the key assessment points.
Oh, that's a good one.
Yeah.
It stands for wakefulness, irritability, tremors, hypertonia, diarrhea, respiratory distress, apnea, weight loss, alkalosis, and lacrimation.
That's a lot to watch for.
It is a lot to watch for. And it seems like caring for these babies goes beyond just managing those withdrawal symptoms. It's about providing the supportive care and creating a calming environment.
Yeah, like swaddling gentle, rocking, minimizing stimulation can all help.
Exactly.
And we also need to be mindful of the mother's situation.
Absolutely.
And provide her with the support and resources she needs.
A non-judgmental approach is essential.
Yes.
You want to help both the mother and the baby get through this challenging time.
Okay, shifting gears again, let's talk about a condition that's incredibly common in newborns. Hyperbilirubinemia, or jaundice.
Jaundice.
Most newborns experience some degree of jaundice, that yellowing of the skin and eyes, caused by a buildup of bilirubin in the blood. And it's usually just a normal physiological process as the baby's liver adapts to life outside the womb.
It is.
But sometimes it can be more serious, right?
You're right. We have to be able to distinguish between what we call physiologic jaundice, which is generally harmless,
and pathologic jaundice, which can lead to complications if not addressed.
So how do we tell the difference?
So physiologic jaundice typically appears after the first 24 hours of life, and it gradually fades on its own. Pathologic jaundice, however, may appear earlier, rise more rapidly, and reach higher levels.
And we especially worry about kernicterus. Which is brain damage caused by very high bilirubin levels.
That's right. Kernicterus is a very serious complication.
Yes.
So we need to be vigilant about monitoring those bilirubin levels and intervening when necessary.
So what are some of the interventions that are used to manage jaundice?
So for mild cases, frequent feedings and close observation are often all that's needed. But for more severe cases, phototherapy might be necessary.
That's where they put the baby under those special blue lights.
Exactly. The light helps to break down the bilirubin, making it easier for the baby's body to get rid of it. In extreme cases, an exchange transfusion might be needed. Wow.
But that's pretty rare.
It sounds like it's all about recognizing the signs of jaundice.
Yes.
Assessing its severity and then taking the appropriate steps to manage it.
Exactly. Now let's talk about another potential threat to newborns.
Okay.
Neonatal sepsis.
This is a serious infection.
It is.
That can quickly become life-threatening.
It can, because newborns have immature immune systems. They're particularly vulnerable to infection.
What are some of the common signs of sepsis that nurses should watch for?
So it can be tricky because the signs can be subtle.
Okay.
We might see things like fever, lethargy, poor feeding, respiratory distress changes in skin color.
So it's about being really observant.
And
picking up on any subtle cues that something might be wrong.
Exactly. Early detection and intervention are key to improving outcomes in cases of neonatal sepsis.
So prompt treatment with antibiotics and supportive care make all the difference.
Absolutely. Now let's shift our focus to congenital conditions that can have long-term implications for newborns.
So we talked about a few of these earlier, like heart defects and Down syndrome.
Right.
But there are many others that nurses need to be familiar with.
Let's delve into a few specific examples.
Okay.
So, esophageal atresia, Omphalocele gastroschisis, imperforate anus, and bladder exstrophy.
Okay. Those sound like some pretty complex conditions.
They are.
Let's start with esophageal atresia.
Okay.
What exactly is that?
So esophageal atresia is where the esophagus, the tube that connects the mouth to the stomach, doesn't form properly.
Okay.
Often there's an abnormal connection between the esophagus and the trachea called a tracheoesophageal fistula.
So imagine trying to swallow.
Right.
And instead of going to your stomach, food or liquid ends up in your lunch.
Exactly. These babies are at high risk for aspiration.
Right.
So recognizing the signs early on is crucial.
And surgery is usually needed to repair that defect.
It is. Yeah. Until then, the baby needs to be fed through a tube, often a gastrostomy tube. Okay.
That's surgically placed directly into the stomach.
Okay, now what about omphalocele and gastroschisis?
Okay.
These conditions both involve the intestines protruding outside the baby's body.
Right.
But there's a key difference, right?
There is. So with omphalocele, the protruding organs are covered by a thin sac.
Okay.
While with gastroschisis, they're not.
So in gastroschisis, the intestines are directly exposed.
Right, which can lead to more complications.
Both conditions sound pretty serious.
They are both omphalocele and gastroschisis require surgery to place those organs back inside the body and repair the defect. And the surgeries are often done in stages, especially if the defect is large.
Okay, now let's talk about imperforate anus. What exactly does that mean?
So imperforate anus is when the anal opening is missing or blocked.
Okay.
Essentially, the baby can't pass stool normally.
That sounds like a major problem.
It is, and it usually requires surgery to create a new anal opening and connect the rectum to it. And lastly, we have bladder exstrophy. This one sounds particularly challenging.
Bladder exstrophy is a rare condition where the bladder is turned inside out and exposed outside the body. It's incredibly complex and requires multiple surgeries to repair the bladder and reconstruct the surrounding tissues.
Wow. These congenital conditions really highlight the resilience of these tiny humans.
You do.
And the incredible advancements in medical care that allow us to help them.
I agree, and they also underscore the importance of a strong collaborative team approach to care.
Yes.
We're all in this together, nurses, doctors, surgeons, therapists.
And the families.
And of course the families.
Speaking of families, I imagine that receiving a diagnosis like this for your newborn,
it can be incredibly overwhelming.
Yeah.
These are life-altering diagnoses, and families need our support, our empathy, and our clear communication every step of the way.
Yeah, we've talked a lot about the medical management of these various conditions.
Right.
But it seems like the emotional aspect of care is just as important.
It is. These families are going through a lot, and they need to feel heard, supported, and empowered.
Okay, let's shift gears a bit and talk about something that's crucial in the NICU.
Okay.
Infection prevention.
Infection prevention is paramount, especially for these vulnerable newborns.
Right.
Meticulous hand hygiene, strict sterile technique, and minimizing invasive procedures are all essential.
And it's not just about nurses being diligent.
Right.
It requires a culture of safety within the entire healthcare team.
You're right. Everyone who interacts with these babies, from the doctors to the respiratory therapist to the housekeeping staff, plays a role in infection control.
And we need to be constantly vigilant watching for any signs of infection.
Absolutely.
Subtle ones.
Newborns might not show the same obvious symptoms as older children or adults.
Right.
So we have to be extra observant.
And if we suspect sepsis, We need to act quickly.
We do. Early intervention is key.
To preventing those serious complications.
Okay, now let's talk about another challenge.
Okay.
That often goes hand in hand with congenital conditions.
Okay.
Nutritional support.
Nutritional support.
Many of these babies have difficulty feeding.
They do.
And might need specialized formulas or even intravenous nutrition.
You're right. Meeting their nutritional needs is critical for growth and development, but it can be a real challenge.
Yeah. Some babies might have anatomical abnormalities
Right.
that make it difficult for them to suck and swallow.
Exactly.
And others might have digestive issues
Right.
that make it hard for them to absorb nutrients properly.
Right.
So we might need to get creative
We might.
using specialized feeding techniques,
Correct.
adaptive equipment,
Right.
or even alternative feeding routes,
Uh-huh.
like nasogastric or gastrostostomy tubes.
Exactly.
And close monitoring is essential to make sure the baby's gaining weight,
It is.
thriving.
Regular weight checks, assessments of feeding tolerance, careful attention to intake and output are all crucial.
Yeah. And of course, providing emotional support to parents who are struggling to feed their baby.
Absolutely.
It can be a very stressful and frustrating experience for them.
It can.
They might feel inadequate or guilty.
Right.
So we need to offer reassurance guidance, practical tips
Right.
to help them navigate these feeding challenges.
It's about empowering them and letting them know they're not alone.
Okay, now let's talk about something that's often overshadowed
Okay.
by the medical complexities of these conditions,
Like,
the long-term developmental implications.
right.
Many of these babies will need ongoing care and therapies
They will.
to reach their full potential.
We need to be thinking beyond that immediate neonatal period.
Right.
These babies might face challenges with motor skills,
Okay.
cognitive development, speech and language, social emotional development.
And early intervention is key.
It is the earlier we start those therapies, the better the outcomes for these children.
So as nurses, we need to be advocates for these babies and their families, connecting them with resources like physical therapy, occupational therapy,
Right.
speech therapy, early intervention programs.
Couldn't agree more. We're not just providing care during their hospital stay.
Right.
We're setting them up for success in the long run.
Now let's touch on a topic that can be incredibly difficult
Okay.
for both families and healthcare providers.
Okay.
Ethical consideration
Clinical consideration.
when caring for newborns with complex medical conditions.
Right.
We often face tough decisions
We do.
about the best course of treatment.
These are ethically challenging situations
Yeah.
that require careful consideration of the baby's best interests, the family's wishes, and the medical team's recommendations.
And sometimes those interests might conflict.
Absolutely.
Yeah.
For example, what if a baby has a severe congenital condition
Right.
that requires multiple surgeries and a lifetime of medical care? What if the prognosis is poor and the baby is likely to experience significant pain and suffering?
Those are incredibly difficult questions to grapple with.
They are, and there are no easy answers.
Right.
But it's important to have those open and honest conversations with the family, provide them with accurate information about their baby's condition,
Yes.
the potential benefits and risks of different treatment options.
And ultimately, the decision about how to proceed should be a shared one, made in collaboration with the family and the medical team.
You're right. We need to respect the family's values and beliefs
Yes.
while also advocating for that baby's well-being.
These ethical dilemmas really highlight the importance of having strong communication skills,
Absolutely.
a deep understanding of ethical principles,
Right.
and a compassionate approach to care.
Couldn't agree more. Now, let's shift gears a bit and talk about something that's often overlooked but incredibly important. The emotional well-being of nurses who care for these vulnerable babies.
You're right. It's emotionally demanding work.
It is.
And it can take a toll on us.
We're constantly exposed to suffering, loss, difficult ethical dilemmas.
And we're also dealing with the stress of working in a high-pressure environment.
Right.
Where every decision can have life or death consequences.
It's crucial to acknowledge the emotional impact of this work and to develop healthy coping mechanisms.
Self-care is not a luxury, it's a necessity.
Exactly. We need to prioritize our own well-being so that we can continue to provide that compassionate and effective care to our patients and their families.
And seeking support from colleagues, supervisors, or mental health professionals is a sign of strength, not weakness.
Absolutely. It's important to remember that we're not alone in this. We have a community of support that we can lean on.
Now let's loop back to something we mentioned earlier.
Okay.
The importance of evidence-based practice.
Evidence-based practice.
Because in neonatal care, research is constantly evolving.
It is.
New treatment options are emerging all the time.
You're right. It's a rapidly changing field.
Yeah.
And it's crucial for nurses to stay up to date on the latest evidence.
Continuing education, attending conferences, reading journals,
Right.
even engaging in research ourselves are all ways to stay informed and provide the best possible care.
Lifelong learning is essential for any nurse.
Yes.
But it's especially crucial in neonatal care.
Now, before we wrap up this part of our deep dive,
Okay.
I want to touch on a theme that has kind of woven its way through all of our discussions today. The power of observation.
It's the cornerstone of neonatal nursing.
Yeah, these babies can't tell us what's wrong.
Right.
So we have to rely on our senses,
Yes.
our clinical judgment, and our intuition
Right.
to assess their condition and anticipate their needs.
We're constantly gathering data, looking for those subtle cues, noticing changes in their behavior, their breathing, their skin color, their vital signs.
And those observations, combined with our knowledge and experience, really guide our interventions and ultimately shape the care that we provide.
It's a delicate dance between science and art.
Yes.
Between objective data and subjective interpretation.
And it's what makes neonatal nursing both challenging and incredibly rewarding.
I couldn't agree more.
Wow. We have covered so much ground in this deep dive.
We have.
From understanding the difference between acquired and congenital conditions
Right.
to really exploring the complexities of managing these tiny patients in the NICU.
It's a lot to take in.
Yeah, it is.
But it's so important to have a good grasp of these concepts to provide the best possible care for these babies.
Thinking back to all the conditions that we've discussed, what stands out to you as the most important takeaway for our listeners?
You know, I think the overarching theme here is that nurses are the eyes and ears of the NICU.
Yeah.
These babies can't tell us what's wrong.
Right.
So we have to be incredibly observant, picking up on those subtle cues and changes in their condition.
So recognizing those early warning signs.
Yes.
And advocating for these patients who can't advocate for themselves.
Absolutely. And also recognizing that we're not just caring for the baby.
Right.
We're caring for the whole family.
Yes.
These are life-altering diagnoses.
Yeah.
And families need our support, our empathy, and our guidance every step of the way.
I think we have equipped our listeners with a solid foundation of knowledge.
I hope so.
About acquired and congenital conditions in newborns.
Yeah.
But it's important to remember that this is just the beginning.
Absolutely.
Neonatal care is constantly evolving.
Right. New research is emerging all the time. Best practices are always being updated.
So lifelong learning is essential.
It is.
Whether it's attending conferences, reading journals, or participating in research.
Right.
We need to stay curious and committed to expanding our knowledge base.
I couldn't agree more. And I want to emphasize that it's okay to ask questions.
Yes.
Seek guidance from those more experienced nurses.
Right.
And lean on your support system. Yes.
This is challenging work.
It is.
And we all need a little help sometimes.
Well said. So as we wrap up this deep dive, what's one final thought you'd like to leave our listeners with?
You know, just remember that every interaction you have with these tiny patients and their families has the potential to make a difference.
Yes.
You are a vital part of their care team.
Absolutely.
And your knowledge, your skills, your compassion can truly impact their lives.
Yes.
Embrace the challenge, stay curious, and never underestimate the power of your presence in the NICU.
That's a perfect note to end on.
I think so.
Thanks for joining us on this deep dive.
Thank you.
We'll see you next time for another fascinating exploration into the world of nursing.
Sounds good.